Alright guys, in lesson 7.2, we are going to talk about the ear. So in the last lesson, we talked about the eyes. This one, we're going to talk about both the anatomy and function of the ear as well as some of the disorders that can come with it. So the first thing is a couple questions to think about that we will be answering as we go through this section. One, why do we have earwax? Some people have a lot more than others. What is the benefit of it? Is it something that we should be getting rid of completely, or is it something that's actually good for us? How does yawning wide while descending from a height help to equalize pressure in the ears? Why do our ears hurt when we're in airplanes? And why do we open our mouth really wide to pop them? What does that actually do? So the first thing we're going to talk about is the anatomy of the ear. So one of the main things is that the ear is actually broken down into three parts. You have the outer ear, you have the middle ear, and then you have the inner ear. The inner ear is also where your ear canal is. We'll learn how that's where your earwax mainly builds up. And your inner ear is important for things like balance, maintaining equilibrium, and things like that. Your external ear, also known as your outer ear, this is the part where you can see is what you actually see from the outside. Sorry that it's overlapped. But this is called the auricle or the pinna. And it comes in a different shape. So a lot of people have, as humans, we kind of have this similar look of the ear, but sometimes people's ears can be smaller or bigger or whatever. It doesn't really benefit us how the auricle looks like because it's not really doing anything like tremendous to help us with hearing. But for certain animals though, it is helpful. So for like rabbits, who can, have long ears, it can help them, be able to hear sounds from long distances, and other animals are really great at hearing vibrations, things like that. So the auricle is actually going to be connected, or the external ear is going to be connected to something called the auditory canal. The auditory canal is also known as your external acoustic meatus. And it's made out of skin. It's surrounded by skin, and it has something called ceruminous glands. And the ceruminous glands, they secrete something called cerumen, which is also known as your earwax. This earwax is really good because it actually lubricates and protects your ear. So earwax can catch any dirt or grime that might go into your ear to be, cause some kind of infection or something. But instead of allowing it to go into your middle ear or inner ear, it can catch it and prevent that from happening. And then, so once you go from your auricle to your auditory canal to your the next thing is your tympanic membrane. And then your tympanic membrane is this little like turquoise thing that you see right there, also known as your eardrum. And this is what will actually vibrate when sound waves hit it, and then help you to hear different sounds. And the tympanic membrane or your eardrum is actually going to separate your outer and your middle ear. So then we're moving on to our middle ear, which is your tympanic cavity. It starts at your tympanic membrane. So your tympanic cavity is a small chamber in the temporal bone, it's a small chamber in your temporal lobe of the skull. And it's going to be located on the lateral side, versus on the medial side, it's going to be something called an oval window. So remember, your tympanic membrane is your eardrum. It's going to be more on the lateral side, which is on the outside. And then your oval window is going to be more on the middle part of your body. All right. So in the middle ear, there are something called ossicles, which are basically 3 of the smallest bones in your body. And they're basically known for their shapes. So one of them is called the hammer, or known as the malleus. Another one's called the anvil, also known as the incus. And the third one is called the stirrup, or also called the stapes. The ossicles, these 3 bones, they help to amplify and transmit sound waves from the outside part to the inside. If you hear my baby in the background, she is just chatting it up right now with her dad. The one way to remember this is HAS, H-A-S, hammer, anvil, and stirrup. This will kind of give you a clue as how they're ordered. So hammer is going to be the first bone kind of closest to the eardrum, and then it's going to go more internal from the hammer, anvil, and stirrup. The stirrup being connected to the oval window. Another thing too, and you can kind of look at the diagram here and kind of see where they're located and how that kind of connection happens from the eardrum to the oval window. The middle ear, also continuing, like I said, it connects the tympanic membrane, which is the eardrum, all the way to the oval window. And these three bones, the hammer or the malleus, the anvil, which is the incus, and then the stirrup, which is the stapes, help to connect the tympanic membrane and the oval window together. There's also something known as a eustachian tubes, and these are going to connect the middle ear to your pharynx. Your pharynx is basically in your throat, and it's what connects your mouth to your nasal cavity, and then to your esophagus. And your esophagus obviously is where your food goes down for digestion. Your eustachian tubes, they're really important because they equalize pressure in your middle ear. And so when you yawn, you're actually bringing the pressure to your pharynx, your eustachian tubes, and your middle ear to the same pressure as the outside of the ear. And that's why when you are, in a plane, your atmosphere is changing, and so you have different in pressure. And so you feel that in your ear. So when you yawn, you are trying to equalize that pressure from the outside to the inside. Okay, moving on to your internal ear. Your internal ear is going to be connected by the oval window. And so your internal ear also looks like a bunch of tunnels, and these tunnels are called a bony labyrinth. And there's three parts in your internal ear. You have your cochlea, you have your vestibule, and you have your semicircular canals. Your vestibular and your cochlear nerve, there are these two nerves, your vestibular nerve and your cochlear nerve, and they're going to send sensory information from your vestibule and from your cochlear. And these signals are going to be able to, or the sensory information is going to be able to be translated later on. Your cochlear is actually going to be carrying specific information about hearing, and then your vestibular is going to carry specific information about balance of your body. Now, your vestibular and your cochlear nerve together are going to make up your vestibulocochlear nerve, and then that is what is going to be taken to your brain to be deciphered. Okay, so your vestibular cochlear nerve, like I said, these are what is going to be the combination of your cochlear and your vestibular nerves, and they're going to pretty much take the stimulus from both parts and take it to your brain so that it can be deciphered there and translated to what you are hearing / where your orientation of your body or your head is so that you can balance and have that equilibrium. What role do you think the inner ear plays in the development of a phobia such as fear of heights? So the inner ear infection can cause vertigo, which is basically a balance disorder. You feel like the room is spinning. You don't have really a sense of stability. And people who have this can also have a lot of issues when they're looking down at things from a tall place, such as like a roller coaster, a window in a tall building. And so a lot of people can have this with or without vertigo, but the people who do have vertigo, this can be more severe. Okay, so your internal ear has something called a bony labyrinth, which is basically, it has a fluid that it fills it up called a perilymph. And the bony labyrinth also has tubes called membranous labyrinth, which is basically, has a membrane to it, like a skin, and it is filled with something called an endolymph. Moving on to functions of the ear. So one of the main functions is obviously your ear is important because it's detecting sounds from your environment. It's taking in different sound waves, stimulus from the environment, and it is deciphering it. So how does this work? When you have hearing, you have a sound being produced. It's going through your auditory canal. It's going to go and vibrate on your eardrum, which is your tympanic membrane. Your ossicles are going to, which are your hammer, anvil, and stirrup, they're going to amplify the sound and take those vibrations and send it through your oval window. And then it's going to reach your endolymph and your perilymph, which is a fluid in your inner ear, and which are going to then move. This movement of your fluid will then be passed on. So, your hearing is going to be deciphered in, it's going to go into something called the cochlea. Cochlea is a very, it's like the snail looking thing that you will see in your ear. You can also see this in the kind of mock ear I have in the back of the classroom near my desk. So your cochlea, which is your inner ear, this is what is really allowing us to hear. So inside the cochlea, you have a membranous labyrinth called the cochlear duct. Inside the cochlear duct, you have something called the organ of Corti. Now, the organ of Corti has something called little hair cells. They're not actual hair that you have like on your arms or your head, but they're cells that look like tiny hairs, and they are what act as hearing receptors. The short hairs that is inside of the organ of Corti, they are going to be stimulated by high-pitched sounds. The longer hairs in the organ of Corti are going to be stimulated by low-pitched sounds. Now, the endolymph this is how the hearing is actually going to work. If you look on page 712, figure 712, page 250, there's a really good image in your textbook that's really going to be helpful. Again, it's page 250, figure 7.12. So what happens is the endolymph, which is a fluid in your cochlear duct, it's going to cause your tectorial membrane to move. This is going to cause your hair cells to move in your Corti, organ of Corti. The cochlear part of the vestibular cochlear nerve is going to be stimulated because the cochlear part of your vestibular cochlear nerve is what does the hearing part. Once that gets stimulated, it's going to send electrical signals from the cochlear nerve to the auditory part of your brain, which is in the temporal lobe, so that your brain can now decipher what the sound waves you are hearing. Is it a dog? Is it a cat? Is it a bulldozer? Is it thunder? What role do different kinds of hair cells play in relaying sound messages to the brain? We just talked about this. Short cells, hair cells, are for high-pitched sounds and high frequency. Longer ones are for low-pitched sounds. So let's talk about equilibrium. Equilibrium is basically how well you're able to balance, and this is going to happen in your inner ear. So your inner ear has something called semicircular canals in the vestibule. The semicircular canals are really important for balance in stationary and moving objects. The semicircular canals, they also have hair cells similar to the organ of Corti that are going to be moved or can move when they are stimulated by the endolymph, which is the liquid, just like they would be in the organ of Corti. And remember, the organ of Corti is in your cochlea. Here, in the semicircular canals, the hair cells that they have are going to stimulate the vestibular nerve. Now, the vestibular nerve is what is going to be sending things that have to do with balance, right? So they're going to send the stimulus about balance to the cerebellum. The cerebellum is going to get this information about orientation and motion of the head and therefore be able to decipher it. So let's check our understanding. What are two functions of the ear? Hearing and balance. What is the function of the cerumen? This is to clean and lubricate and protect the ear. Remember, cerumen is another fancy word for your earwax. The ossicles, which are your three little tiniest bones of your body, which is in the middle ear. They connect your tympanic membrane, which is your eardrum, to the membrane of the oval window. What is the significance of the eustachian tube? Connects the middle ear to the pharynx, so that you can have the same pressure in your ear and to the outside atmosphere. And then what structure in the inner ear controls equilibrium? This is your semicircular canals. Okay, let's talk about the infections of the ear. So a lot of things can affect your hearing and your balance that you may not even realize. Some things you might be doing, like listening to loud music, or other things can be completely accidental or, because of some kind of infection. So one of the things is deafness. You've probably heard of deafness, but you might not know that deafness is not only complete loss of hearing, but it can actually be very minimal loss of hearing. So any loss of hearing, whether it's very slight to completely being all gone, can be under the category of deafness. And why do we have deafness? So a couple of things can happen. Some kind of injury to your middle and inner ear, because this is where you have your organ of Corti. This is where you have the hair cells that are, the ones that are really in charge of hearing. So any kind of damage to your hair cells can cause you to have hearing loss. So things like I said before, loud music, especially now that we have headphones that go directly into our ear and then we blast it out loud. That is, really more harmful than having those, headphones that go around your entire ear. A loud construction noise that can also damage and cause deafness as well. And then other things like a lot of earwax can minimize the amount of sound waves that are coming into your ears. Anything that can cause damage to your eardrum, which is your tympanic membrane, such as, using Q-tips, or if you stick something sharp in your ear, or a lot of pressure. And so you can have also nerve damage, which is just inflammation of your auditory nerve, which is, going to minimize the amount of information that's getting to your brain, because you're not receiving enough sensory input. There's also something called presbycusis, which is basically age-related hearing loss. And, this can be improved obviously by hearing aids. So a lot of older people have hearing aids to help with that. Hearing aids are awesome because they can help to kind of balance out what you lack with amplifying and changing the sounds that you are, getting from the environment, to accommodate the person who's wearing the hearing aids. There are different types of hearing aids. There's some that can amplify just all sorts of sounds because maybe you just can't hear anything in general. Or you might need help hearing lower frequencies or higher frequency sounds. And so there's hearing aids that can help with those specifically as well. So there's different types of hearing aids. There's in the canal ones, which is just, like it says, custom modeled, that actually fit inside of the canal, our auditory canal. There's half shell, which is to fit inside the, it's kind of in the auricle, and it shapes the, the little indentation in your auricle area. And then there's in-ear, which is fit to make fit in most of the outer ear part of your ear. Sometimes it can fit a little bit more inside in the canal. Then you have the behind the ear, which is, you can notice this in a lot of people who wear these. They kind of sit behind the most external part of your ear. And this is able to amplify sounds, so that they are receiving it better in your canal. Tinnitus is another issue that people have with their ears. This is when you have ringing in your ear. This is usually because of damage to the hair cells in the organ of Corti. When you have damaged hair cells, they start to move in different ways randomly, and they create this ringing sound. And this is usually caused because of loud sounds that damage your hair cells. A lot of people experience this issue. Swimmer's ear is also something that is common, usually because of a bacterial or fungal infection in your auditory canal because of some kind of contaminated water that has gotten into your ears. Symptoms can be, temporary hearing loss, pain, fever. Honestly, anything that has to do with your ears that's painful is like one of the worst pains you can ever feel because it's just piercing. Middle ear infection, otitis media. This is when you have bacteria and virus in the middle ear, and it can sometimes be coupled with upper respiratory tract infections. A lot of infants and toddlers experience this because of your eustachian tubes are not completely developed to when you are an adult. And so you can have a lot of pain, swelling. Sometimes they have pus that comes out. So it's very uncomfortable and painful for them. There are, usually the mild to moderate level of this type of infection is caused by some kind of bacteria. Sometimes if it's very severe, like a lot of kids are getting continual ear infections, they do put small tubes inside of your tympanic membrane, which is your eardrum, and it can kind of like relieve the pressure that is inside of the ear. So, and then usually the tubes will just fall out. And then if you have a viral infection in your middle ear, it will improve over time. Okay, labyrinthitis in your inner ear is also your inner ear infection. This is when you have inflammation in your semicircular canals. And then, this is really uncomfortable. It can cause vertigo, which is just really severe dizziness. The room is spinning, you can't stand, you have vomiting, you can have nausea. And then you have Meniere's disease, which is just when you have swelling of your semicircular canals, and it's longer, it's chronic. And then you can have, along with this, vertigo that comes and goes, as well as hearing loss. You can treat this with antibiotics so that it doesn't get worse. So let's check our understanding. List the causes of deafness. So we talked about this, right? This is when you have some kind of injury to your middle or inner ear. This damages the hair cells, which can cause permanent damage because hair cells can't grow back. So it can either be due to loud noises like construction noises. It can be earwax buildup. You can have damage to your eardrum, so on and so forth. We also talked about age-related hearing loss, and that is presbycusis. And then when you have ringing in your ears, that's called tinnitus. And then infants and toddlers are more prone to otitis media because their eustachian tubes are not fully developed.